So thanks for the ball here, Airway Champion. So we don't ever say based on appearance you have a tongue tie. You would need a full orofacial functional evaluation from a specialist that is trained in orofacial myology and feeding for your age of your child. So when we talk about sticking out the tongue, that has nothing to do with what we're looking at for function. At your child's age, there should be a resting posture of the tongue with light suction and light seal against the palate. And so if you are looking at your child sleeping and they're laying down, you should be able to lower the jaw and then see the tongue resting in the palate. Great that they've had a good latch, but I also see that the infant, your child, has their mouth partially open, and I'm also seeing that the tongue is resting more forward, and then there's a lot of saliva pooling down and around the mouth. So this could mean that there's lack of saliva control, there's lack of pressure against the palate, there's lack of proper pressures within the facial muscles, and that's what grows our faces. So we're talking about mitigation of risk factors down the road for proper facial growth, dental growth, speech, functional abilities of what those muscles do, so like chewing and swallowing. So you're going to need, I'm sorry, this is not an easy, simple answer, but you're going to need to find somebody that's a specialist in orofacial function, specifically for infants, looking into feeding, but also has orofacial training. So the Tongue Tied Center in London, I'm not sure where you're at in the UK, but you can also drop location. I didn't see it, but it doesn't mean you didn't drop it. And then just once again to reiterate, you can't stretch a tie, it's collagen. So you can stretch the fascia around and tone things up, and that's really what we would do too, is tone the muscles to encourage mouth closure and lip closure and tongue sealing in the palate, and then also address what's the root cause. Why is that tongue low and forward? It could be multifactorial, so maybe some allergies or things like that. So long-winded answer, but we need to get to the root symptoms, and we need to find somebody that's a specialist for you in your area. And then to reiterate, we don't assess a tongue tie by just a visual appearance. We need to look at other multifactorial concerns with eating and feeding and tongue posturing for this age group.